Chapter 10, The Cranial Nerves. Question 1. A malignant tumor is damaging the patient's glossopharyngeal nerve. They will experience a. Loss of taste over the anterior 2/3 of the tongue. b. Loss of somaesthetic sensation over the anterior 2/3 of the tongue. c. Loss of taste and somaesthetic sensation over the posterior third of the tongue. d. Paralysis of the muscles of the tongue. Correct answer is c. Loss of taste and somaesthetic sensation over the posterior third of the tongue. The lingual branch of the mandibular trigeminal carries somaesthetic sensation, and the chorda tympani branch of the facial nerve relays taste sensation from the anterior tongue. The hypoglossal nerve is the motor nerve to the muscles of the tongue. Question 2. A patient is stabbed in the neck. You suspect damage to the accessory nerve in the posterior triangle. You would test nerve function by asking the patient to a. Extend their neck against resistance. b. Extend their neck without impairment. c. Lift their shoulders against resistance. d. Lift their shoulders without impairment. Correct answer is c. Lift their shoulders against resistance. The accessory nerve supplies muscles which flex the neck and elevate the shoulders. Wherever possible, it is advantageous to test muscle action against resistance to eliminate trick movements the patient may have developed, and to make the muscle stand out or become palpable. Question 3. Loss of somatic sensation over the anterior 2/3 of the tongue indicates damage to the a. Lingual branch of the mandibular trigeminal nerve. b. Chorda tympani branch of the facial nerve. c. Lingual branch of the glossopharyngeal nerve. d. Hypoglossal nerve. Correct answer is a. Lingual branch of the mandibular trigeminal nerve. The chorda tympani carries taste sensation from the anterior tongue, and the glossopharyngeal nerve conveys taste and somaesthetic sensation from the posterior third. The hypoglossal nerve is the motor nerve to the tongue muscles. Question 4. Examination of a patient indicates that they have a medially directed strabismus, squint. This could be due to damage to the a. Oculomotor nerve. b. Trochlear nerve. c. Ophthalmic trigeminal nerve. d. Abducens nerve. Correct answer is d. Abducens nerve. The eye will be pulled medially when the muscles that turn the eye laterally are non-functional because of unopposed action of the antagonist muscles. The lateral rectus supplied by the abducens nerve is the main abductor, but the two oblique muscles also exert a lateral pull and would still be functional. However, their lateral action is countered by the action of medial rectus and the medial pull of superior and inferior rectus. The action of these three muscles will negate the action of the oblique muscles, producing a medial strabismus. Question 5. A patient suffers damage to the orbit in a road traffic incident resulting in damage to the third cranial nerve. Which of the following signs will be present? a. Pupillary constriction and a medial strabismus. b. Pupillary dilatation and a medial strabismus. c. Pupillary constriction and a lateral strabismus. d. Pupillary dilatation and a lateral strabismus. Correct answer is d. Pupillary dilatation and a lateral strabismus. The oculomotor nerve supplies 4 of the 6 extraocular muscles and the papillary constrictor muscles. The pupil dilates due to unopposed action of the dilator papillae muscles. The eye will also be pulled laterally by the unopposed action of lateral rectus and superior oblique muscles supplied respectively by the 6th and the 4th cranial nerves. Question 6. Which of the following statements is true of the pupillary light reflex? a. Its efferent limb is carried in the optic nerve. b. It is mediated by the inferior colliculi in the midbrain. c. It is a consensual reflex. d. Its afferent limb is carried in the oculomotor nerve. Correct answer is C. It is a consensual reflex. The afferent stimulus for the light reflex is via the optic nerve and its efferent limb is through the oculomotor nerve. The inferior colliculi are involved in auditory reflexes, the superior colliculi mediate visual reflexes. Question 7. The seventh cranial nerve supplies A. Taste buds on the posterior third of the tongue. B. Muscles of the soft palate. C. Muscles of the lower lip. D. The parotid salivary gland. Correct answer is C. Muscles of the lower lip. Taste buds in the posterior tongue and the parotid gland are supplied by the ninth cranial nerve, muscles of the soft palate by the 10th nerve. The facial nerve supplies the muscles of facial expression, which include the muscles of the lips.